Hello. So I got in the middle of the night last night. My phone is on Do Not Disturb, but I got the rest of my heart stuff from my chart. I don't have the bone scan yet. Um, it's two of them. Okay, so for my echo, um, uh, normal left ventricle size and normal wall thickness, normal left ventricle systolic function, normal left ventricular regional wall motion, left ventricular ejection fraction is approximately 60 to 65%. Normal left ventricle diastolic function. Normal right ventricular size and normal systolic function. TAPSE 2.3 centimeters. DTI 12.0 centimeters. Normal atrial sizes. Here's the bad part. Well, there's another bad part. Mild mitral valve regurgitation, which mild tricuspid valve regurgitation with estimated pulmonary artery systolic measure of 29 millimeters Hg if right atrial pressure is 3 millimeters Hg. So, normal right atrial size, right atrial pressure is estimated at 3 mmHg. Normal mitral valve thickness, mitral valve annular calcification is present. That's the other bad one. Mild mitral valve regurgitation. So I got a little bit of the hardening of the arteries in my mitral valve. It does say mild. Tricuspid valve is normal in structure. Mild tricuspid valve regurgitation. Tricuspid regurgitant velocity is 2.6 m/s, and with an assumed right atrial pressure of 3 mmHg. The estimated right ventricular systolic pressure is normal at 29 mmHg. The aortic valve is trileaflet and structurally normal, with normal leaflet excursion. No evidence of aortic valve regurgitation. Pulmonic valve was not well visualized. No indication of regurgitation. Normal mean pressure by RVOT spectral signal. Aorta, the aortic root is normal in size and structure. Normal mild ascending aorta. Normal arch and normal descending. No coarctation of the aorta. Let's just look up what that means real quick. Coarctation. It's a narrowing of the largest artery in the body that forces the heart to pump harder. Okay. So I don't have that. Great. Pulmonary artery was not well seen. Pulmonary veins appear normal and return normally to the left atrium. Systemic veins, the inferior vena cava is normal in size and exhibits greater than 50% respiratory change. Pericardium, there is no evidence of pericardial effusion. So it looks like the issues that I will have in the future are sort of already there, but they're not yet, problems. I think this is, if people would get these scans younger, even maybe younger than me, maybe in their 30s, maybe we could catch some of this stuff early before they become really big issues. Like the calcification, it's a big fear in today's world. But my diet has completely changed, and obviously I'm still spitting out a lot of cholesterol, and so that's an issue. But I'm on cholesterol drugs, I'm on beta blockers. My diet's changed. So I'm not super worried about that building on itself. But it was a big fear of mine that my arteries would be hardening, and it looks like it's just the one, although one is one too many. And then the valve regurgitation, which looks like it's something that sort of normally happens with age, and you don't need treatment till it gets really bad. And of course, it looks like it's something that I'm going to have to get looked into in later life. But it's possible I'll need some valve replacements in my future. I mean, I'm going to get heart disease. Who doesn't? Like I said yesterday, if cancer doesn't get you, it's going to be your heart. Or, indeed Alzheimer's and things like that. And then I got the stress test. From the cardiologist, he submitted my ECGs that he took. He said normal ECG, normal sinus rhythm, all the things. He told me though that my ECG was perfect. The stress test. Is that what I just read you? No, that was the ultrasound, the echo. Baseline heart rate 73 BPM. Baseline beep. Echo. Stop. Sorry. Baseline blood pressure 110/65. Maximum heart rate 99 BPM. I think I read this yesterday or something. Maximum blood pressure 111/67. During the middle of a stress test, that's pretty good. Predict max HR 174. Oof. Okay. I mean, I don't know, when you're stressed, you obviously would. Baseline blood pressure category is normal. The baseline rhythm was normal. Sinus rhythm. Low voltage was present. There were no arrhythmias. ST segments or T waves were normal at baseline. The patient developed shortness of breath. Yes, that's true. During the stress exam, I had to take my mask off. The peak stress heart rate achieved was 99 BPM, which 7% the age predicted max heart rate. The peak blood pressure during stress was 111/67. The double product achieved was 109.89. I don't know what that means, but there it is. The primary reason for test termination was end of protocol. The blood pressure response to stress was normal. The heart rhythm during stress was sinus rhythm. There were no arrhythmias, and so on. Symptoms resolve within 2 to 3 minutes, yes. ECG findings are not suggestive of ischemia. Patient symptoms were not suggestive of ischemia. And then it says nuclear stress testing will be reported separate. I guess that's what this is here. Indication. A 46-year-old female with PBC with cirrhosis referred for evaluation for the presence and extent of ischemic heart disease as part of a pre-liver transplant evaluation. This is all the same stuff. No significant motion artifact or significant attenuation artifact. Diaphragmatic attenuation artifact is present. Okay, what does that mean? Let's look that up real quick. Looks like your diaphragm can cause what appears to be an area of ischemia, low blood flow in your heart. It may be a true fixed defect or may not be anything at all. A fixed defect means you have a complete blockage or an almost complete blockage to a terminal segment artery going to your heart. I don't think that's true. Perfusion at rest. Mild decrease in uptake in interior wall. Normal tracer update through the left ventricular myocardium. Perfusion at stress. Normal tracer uptake throughout the rest of the left ventricular myocardium. Left ventricular size normal. Left ventricular ejection fraction less than 65%. Left ventricular wall motion normal. It says impression normal. Regadenoson stress myocardial perfusion spec study. There's no evidence of ischemia or prior I think I read this last night. Myocardial infarction. So there's a couple little tiny issues that are going to be something I need to have taken care of later. But it's good to know well in advance what's coming. So the bone scan I'm a little worried about, but I'm sure it'll be here today or tomorrow. Of course, I'll let you know what that says. Thank you for watching, and I'll talk to you later. Maybe even today. I might talk about what happened yesterday more. I'm not sure. But I'll talk to you later.